Dan dia tak apa, tak payah rekam. Tak berkilat. There's no sound.
Oh, dia orang tak. Tadi.
Hello.
Hello. Am I 30 seconds to live?
Speaker is microphone does not work. It's not the microphone does not work.
It is.
Tak ada memang. Test 1 2. Check 1 2. Okey, masuk.
Okay.
Masuk.
Memang kita terpaksa tutup, kita terpaksa tutup dekat atas tu. Sebab tadi bunyi yang.
Okey, tu aku buat dah. Dah hilang.
Tak apa. So kita terpaksa dengar anything, just dengar kat situ. Sound guide. Untuk yang dekat semua kat sini tak apa. Kita orang dah cover untuk kat dalam.
Okay, 15 seconds. Stand by, 10 seconds to live.
Yeah.
5, 4, 3.
Okay, Bismillahirrahmanirrahim. Assalamualaikum. A very good afternoon to all speakers and the audience online so present in this studio. So before we start, this is the second UCSI podcast, and for today's topics, we have 4 speakers. 3 speakers will be in the studio, and 1 speaker will be online, Dr. Janaki. And before we start for today's podcast, I'm the host. My name is Professor Dr. Zahari Ishaq. So today we will try to have some intellectual discourse regarding on World Suicide Prevention Day, and the main theme is on embracing life. So before we start, this podcast was in conjunction with the World Mental Health Day, where the theme is changing the narrative of suicide. At the same time, Wellbeing Research Center always focus on the stability of well-being and happiness. But before we start, something that I would like to share about this podcast today is we will having 2 rounds of for all speakers, and speakers will be given 10 to 14 minutes. And during the session, most probably, I will try to interject if just anything to add on. And the most important thing is where we try to put it as more, not to be so formal, I would say that. Try to make it very as a normal day happen in our daily routine life, okay? So without further delay, I would like to start introducing my speakers for today. The first beautiful lady, I would say that. Dr. Ann Sri Juwanita Jamaluddin. Wow. Juwanita, how are you, Dr. Ann?
Alhamdulillah, I'm good, thanks, Prof.
Currently, Dr. Ann was the head of the department in Departments of Psychology, Faculty of Social Science and Liberal Arts, UCSI, leading the department, and her background is a clinical psychologist, experience-wise, no doubt, and also a prominent academician. Thank you so much for joining the podcast.
Thank you, Prof. Happy to be here and so grateful to have that opportunity as well to be invited for today's podcast.
Thank you so much. So I don't have to address your full name because your name seems to be a little bit unique. You like to just say what's the meanings of Juwanita? Or I just call Juanita. I don't know, what does it mean?
To be honest, I have no idea. I did ask my dad about it once upon a time, and I gather best not to ask and just embrace it, and then accept it as part of me as well.
So we embracing life today.
Correct,
That's the
exactly.
most important things.
Yes,
Okay.
yes.
Well, let's go for our online speakers. Okay, Dr. Janaki, how are you?
Yes, I'm fine, Prof.
Well, Dr. Janaki is a psychiatrist. She's now currently at the UCSI Hospital Spring Hill. How's the hospital today? Dr. Janaki?
Hospital is going good.
Mm-hmm.
It has already been 3 years since it has been opened, UCSI Hospital. And I'm also with the Faculty of Medicine
Oh, that's great.
Oh,
Okay.
at the Spring Hill
that's great.
campus. Yes.
Okay, Dr. Janaki, thank you
Okay,
so much
Dr.
for
Janaki,
joining
thank
us,
you
even though you are online.
so much
but
for
this is
joining
what
us,
people
even though
see,
you're online.
borderless
But this is
world.
people see
And
borderless
we will
world.
keep on discussing
And we
later
will
on.
keep
Thank you
on
so much, Dr.
discussing later on.
Janaki.
Thank
I
you
see
so
you
much,
later,
Dr.
okay?
Janaki. I
And
see you
our third
later, okay?
speaker
And our third
is
speaker
our handsome guy here,
is
you
our
know,
handsome guy here, you know.
Mr. Kumarish Kumar.
Mr.
How are you,
Kumarish
Mr.
Kumar.
Kumarish?
How are you, Mr. Kumarish?
Thank you for having
Okay,
me.
Mr. Kumarish
Mr.
is a
Kumarish
director,
is
a manager in student affairs and alumni. Welcome to today's podcast, I would say that. And it's great to see you. And beside that, you really engage with students. And the most important thing, you are in the heart of UCSI student, I would say that.
Thank you.
Okay, our last speakers again. Well, far away from IIUM, or International Islamic University Malaysia. How are you, Dr. Haniza?
I'm okay, thank you.
So how's the driving today?
Terrible.
You have to use to.
I have to use it.
Okay, sorry.
It's okay. I'm okay. It's just when it's raining, so it's terrible to be driving.
Okay, I'm so sorry, but you managed to come here on the dot. That is where I'm so happy to see you, you know. So, Alhamdulillah, you are here. So, Dr. Haniza is also a counselor. And beside that, she also represents PERKAMA, Persatuan Counselling Malaysia, who's established in dealing with the counselor in Malaysia. And of course, beside that, Dr. Haniza is also a researcher, very well-known researcher, I would say that, prominent academician, and we will have some talk later on. Okay, welcome to the podcast, Dr. Haniza, and all the speakers. Thank you so much, okay, for joining the podcast today. Well, okay, let's start at the sessions, okay. For today's, I would like to start the session with a very small, tiny case study. I would say the case study may be simple case study, but cut across the population and the setting. Okay, so well, for today, the most important part is we will try to have the embracing life, the value of life, the meaning of life in our daily for daily life. So the most important thing today we have Dr. Ann. Dr. Ann, you ready for the first question, Dr. Ann?
Yes.
Okay, now let's kick and let the ball rolling, Dr. Ann. Okay, let's listen to this, my case study. I will say that, okay? 16 years old girl, feeling sad, most probably stressed, alone for so long time. She had been bullied at school and feel a lot of pressure to get a good grade or today world's, academic performance. Her parent recently divorced, and that makes her life so tough and difficult. Lately, the poor girl has stopped talking to his friend and spend most of the time alone. Google, gadgets, and all kind of things. And one day, she told her close friend that she was thinking to harm herself indirectly to commit suicide. And that poor girl, already start to Google, find out a way how to do that. So, and that poor girl, happened to be your client, Dr. Ann. Okay. So, as a clinical psychologist, what is the first step will you do when you have this kind of a case? So are you going to assess, diagnose, or do intervention, or start talking to the authority, or most probably you will talk to the family because it's underage, what is the procedure that takes place? Or sometimes what is the best way to make sure that the poor girl really need to be safe? Dr. Ann, please.
Okay, thank you, Prof. Zahari. Well, definitely a very heavy and very complex case, but nevertheless, this case is somewhat similar to a few cases that I've dealt before among adolescents. And for this case, obviously, as a clinical psychologist, if she is the first time she's seeing me as a client, obviously I need to get a little bit more background from her. Obviously, give her moment and time to actually express herself, provided that when she comes to me, she actually got some consent from one of the parents, because you mentioned her parents are divorced. So I'm assuming she's staying with one of the parents, and let parents know that she's coming for a therapy session, because I don't have that information. So considering that she did have obtained consent from one of the parents, to come for a session with me. So first things first is that, yes, we'll address her concern, whatever it is that she is presenting in terms of her suicide ideation, feeling lonely, maybe there's a sense of hopelessness. So all of those things are presenting symptoms that we as clinical psychologists have to assess during our intake interview or diagnostic interview. And from there, just a little bit more information, because there's a lot of gaps there that I don't have with me at the moment. Like, how long has she been feeling that, and what are the thoughts that comes into her mind when she's thinking about harming herself, other factors that could contribute towards her feeling the way she's feeling, and that sense of hopelessness and wanting to hurt herself, or even thinking of killing herself. That's quite deep, so there must be something that's building up towards it. So for us, we look at what are the precipitating factor that triggers her anxiety, her thoughts of wanting to kill herself. Is it because of the stresses from examinations, the expectations of doing well? Is it her expectations to herself, or her parents' expectations on her? So all of those things needs to be taken into consideration. What are the triggers? What are the perpetuating things that have been consistently been in her life, like divorce? What else? Her parents' divorce. What about her friends? Any fallouts? You mentioned about bullying, how long that's been, and then also looking at whether or not she does have some protective factors. She has her close friends that she talks to, which helps her to have some space to, express herself. I would like to know a bit more why she is not having that communication, or she's not communicating with her parents that she's staying right now as well. And in terms of her suicide ideation, for us, we also need to assess the level of severity as well. So Prof, you mentioned that she started to think about harming herself, and she started to Google on how to kill herself. So that means there's idea and also there's plan. I need to know a bit more whether or not she had these ideas before, or she had planned before, or she had attempted before. That makes a lot of difference in terms of the level of severity of her suicide ideation, because some clients, they have gone so far that they know when exactly they want to do it, especially when they've already planned who's not going to be at home and all those things. But some can be just out of the blue. They just there's been suicide cases the last, I think, 2 months ago, where an international student just literally jumped off a balcony and all those things, and we knew for a fact that she has been seeing a psychiatrist. She was on the mend, and all of a sudden that happened. So there's a lot of unpredictable factors as well contributing, but nevertheless, it's our job to also assess how risky she is at this moment in time. So she has planned, maybe not concrete plan, but she has ideas and plans. So I would say she would be around moderate risk of hurting herself. And then in that sense also, they have to think about, whether or not she has reached out to anyone in terms of, not just talking to her friends, but has she spoken to anybody else? Like, for example, at school, I'm pretty sure there are school counselors.
Yeah, agree.
But I've heard also that students at school are quite hesitant to go see the counselors as well. I'm so sorry. I don't know.
We try to discuss on that topic later on.
Yeah,
okay.
But looking at the resources that she does have at the moment to actually go and seek help. And in terms of, support, maybe not just friends, but looking at support from family as well.
There might.
Nearer, sorry.
Actually, Dr. M's voice was so so nice to hear. That is where CP are supposed to be.
I'm so sorry. Do you want me to press it a little bit more?
Don't try to be a CP during the therapy session, because this is a podcast, So when you have a podcast, try to be a little bit high tone. And not just, I know that you are very You have a lovely voice. I never deny that. But just to be,
Okay.
make sure that every audience can hear
Okay.
loud and clear. Thank you so much. Sorry to
No, no
interject.
problem.
Okay.
Should have told me earlier. I thought this mic actually picked up.
Oh,
Very,
okay.
it's very sensitive mic because I
Okay.
can't hear it from
Yeah,
here,
yes,
right?
agree. Okay.
Yeah. So continuing from there, looking at support from friends and also looking at the relationship with the family. Does she actually have any support from family as well?
Yeah,
Why is she
agree.
not reaching out to them? Is there something that's hindering her? So there might be something going on with the family as well that made her situation much more worse. So from there onwards, if we need to refer her to see a psychiatrist because of, could be that she already has depression. We're not sure because I cannot assess based on just one session. So there's a lot of screening needs to be done into her emotions, her mental health status, all of those things. And at the same time, if it is her suicide risk is at
Higher
at a
risk,
higher risk,
severity.
so most probably we will have to refer her to see a psychiatrist, or if needed to, we probably have to take her to the hospital emergency, provided that we have to breach privacy and confidentiality in that sense if there's harm towards the patient or harm towards others because of the patient or client. So in that sense, we have to explain to her the situation so that she understood, and whether or not she wants to tell her parents about her condition. Again, privacy and confidentiality, regardless the fact that she is underage. We still need to respect her because she is at the age of informed assent. She can actually think for herself, regardless of her being underage.
Yeah, agree.
And we still have to respect that. But if it's causing her harm, then she has to understand we have to breach that privacy to help her and safeguard her from harm.
Okay, Dr. Ann, I like it's a very long process and a
Yeah.
very tedious process. I will see that from the thing that you discussed with us. Dr. Ann, I just want to know, will the authority, beside the family or the parents, is it wise to share the thinking mind of committing suicide to authority like a police or whoever, Is it possible to do that?
Again, it comes back to how we manage the session itself. If by the end of the session the client's more stable, she's thinking more rationally, and there are resources to refer her, and there are support from friends and also maybe family, depending, then there might not be a need to actually call authority like the police, because we all know that the penal code at the moment is still being discussed, where if a person decided to go for suicide and kill themselves, and they end up not killing themselves in a way that it didn't work, then they will be charged in court.
Agree.
And that's even much more worse.
Yes,
you tried
agree.
to kill yourself and you didn't manage to. On top of that, now you're being charged to try to kill yourself.
Yes,
It doesn't make
yes.
sense. So, but this is our penal code at the moment. But there's been a lot of movement to change that, which is really great. So in a way, we give the client what is best for her, which is treatment and management, not involving authority, because I don't foresee that happening right now. And right now, the client needs a lot of support and not a lot of resources and also skills to help her to manage and regulate herself a little bit better, for further continuity for therapy and also maybe for medication as well, depending on the client.
Okay, thank you so much, Dr. Ann. Well, as all we know, when someone tried to, the thinkings of harming herself or himself, is always there. And it cannot be deleted like a laptop. It's always there. So that's where our podcast today is try to mark the most important thing, embracing life. So that's where we still come to the point that we only have one life to stay in this world. So that's where the podcast is very important. Okay, thank you so much, Dr. Ann. So let's listen to our online speakers, the psychiatrist, Dr. Janaki. Are you still there?
Yeah, hello, Prof.
Hi.
Yeah, I'm here.
Hi.
Oh, we can hear you loud and clear. Lovely voice from you.
Lovely
Thank you
voice
so much.
from you. Thank
Okay,
you so much.
Dr. Janaki, are you ready
Okay,
for the
Dr. Janaki, are you ready for the
next?
session, for the next thing?
Yes, sure, Prof.
Okay, Dr. Janaki,
Okay, Dr. Janaki, as I mentioned just now, was a psychiatrist in UCSI Hospital, Spring Hill.
Negeri Sembilan. So, based on your experience, working with people who have the thought about committing suicide, what are the some common pattern or theme that come up during the treatment? Are these client feeling, are there certain feelings, certain thought, behavior that always can be seen by a psychiatrist during the treatment? And how these patterns, or the theme really help you as a psychiatrist and try to handle the case besides giving some medications and treatment? Would you like to explain to us as a psychiatry viewpoint, please, Dr. Janaki?
Yes, sure, Prof. Okay, thanks for giving me the opportunity to take part in today's podcast. Usually we see the patients, they present with, there will be a sense of like, they feel like they have already been a burden to others in their family or even to their friends. They have some sense of like extreme guilt. They feel like they are no good. Yeah, and they don't have the confidence in them. They have low self-esteem. They feel like the others don't like them. So they start to like, I'm socially withdrawn. If we get the history from the family will say that patient is isolating themselves. So there is a change in their behavior. Then they tend to have anhedonia, which is they lose interest in the hobbies that they used to like to do, which is even seen by the family or those who are close to them. They feel like being hopeless, worthless. There is no point in living in this world anymore. And they feel like they are being trapped and suffering to others as well. So, and also we see sometimes in them, they can have the sleep changes in the sense that they tend to sleep more. In the eating habits, there is also change in the eating habits. They tend to even eat more, or sometimes they don't even, they skip all their meals. And also we can see like some like in some cases they will even give some hint to the family. They will like call the close friends and say like goodbye, or so that sort of hints that we need to pick up, that we need to know that there is something wrong with them. And they can also have like mood swings. They suddenly become very irritable. So these are some of the features, and they tend to like, there is no focus, no concentration, even as this, our example, the student, we're not sure whether she's even able to focus in the class now. So there'll be even problems in her studies as well, in academic as well. And we have to inquire about whether there was any physical or any sexual abuse. That could be like a trauma that is even like triggering her suicidal thoughts now. And also the past history of suicide. Is this her first time she has the thoughts, or has these thoughts been there for a very long time? So these are the things that we need to pick up, and we can pick up from the patient and also from the family and those who are close to her, which will give us a clue of how we want to deal with this patient. Is she having a low suicidal risk, moderate risk, or a high risk? So that is very important. I think this is my comment, Prof.
Okay, thank you so
Okay,
much, Dr.
thank you so
Janaki.
much,
But
Dr.
I just have one quick question before I pass it to the third speaker. So psychiatrists usually deal with the medication or certain drug to be given to the patient. And as a psychologist, I always believe that handling a patient with drugs or medication is not good enough. It should be blend together with the therapies or psychologist treatment. What is your view on that?
This is a very relevant question, Prof. Yes, in psychiatry, we use the biopsychosocial approach, which is biological, which means the pharmacotherapy, which is the medication. We will combine with the psychosocial approach, which is all the psychotherapy and the social support. So it is all a combination, and sometimes even we incorporate the spiritual element as well, because all these things gives a good mental health, mental as well as a physical health to the patient. So of course, a combination works better than rather being alone. So for the and for the medication, it depends. So if upon our assessment we diagnose the patient, for example, if this case is being a major depressive disorder, for example, so we have to start treating the patient, and we have to look also whether she has any underlying personality disorders as well, because one of the common disorders that are related could be in borderline personality. We have to assess whether she has the traits of any borderline personality. And for depression, usually we can treat with antidepressant medications, and we can combine with the psychosocial management, which is the psychoeducation. We educate patient about her illness, give her the information so that she knows the cause of the illness, what are the symptoms, the signs of the illness, and what is the treatment modalities are there. And we combine with cognitive behavioral therapy or even dialectical behavioral therapy, which will bring a very good outcome as compared if we just use medication alone.
Oh, thank you so much, Dr. Janaki.
I have one more question. I will say that. Is it okay? Because in Malaysia context, in the Malaysian context, we treat the psychological problem patient same with the clinical patient. Do you understand what I meant? Meaning that, like, if you go to Australia, there's a two way of getting the treatment. If you have a psychological problem, you go for this mean or this way. Or if you have any clinical problems, you go for the clinical. But in Malaysia, is that going to happen to UCSI hospital, university? I mean, you have two ways of looking at the patient. One is from the psychiatric or psychology perspective. One is from the clinical doctors. What's your view on that?
Is very high among our population. So we feel like, the public, we feel like if we are being referred to the psychologist or to the psychiatrist, it is like label that we are having some mental illness. It's just equivalent to that, because it's yes. So that is the very high stigma here, which has to change. We have not been like open up like the Western countries where patients can just freely walk in. So it's the same. Either medical conditions or psychiatric conditions are being treated as same. But here, because of the stigma, which is very high, that is the one that is hesitating the patient to seek help. The patient might want to seek help, but because of the stigma, the patient is very afraid of being labeled with mental illness. So that because we have the neurotic and also the psychotic illness, so depression and all comes under the neurotic. So it's a non-psychotic illness, but still because of the stigma, they are afraid of being labeled as being a psychotic or being literally called mad by others. So that is what that is hindering the access.
Yeah, agree.
Yeah, I agree 300% with you, Dr. Janaki, because that's where I always believe, there's no help without a mental health. So because of that, sometimes the stigmatization that happen in our society seem to be a huge barrier to have two lanes for a patient in any hospital. And I wish that one day become a reality in Malaysia, because we should have a two lane to address the case. One is a psychology perspective, and one is a clinical perspective. Thank you so much, Dr. Janaki. I will come to you for the next questions. Okay, now let's go for our third speakers. Mr. Kumarish, how are you?
I'm fine, thank you. Thank you.
You good?
Yes, I'm good.
So, as we all know, Dr. Janaki is the director for student alumni in UCSI. So, as a director, do you come across with this kind of issue every day, just to start? Or maybe it's most probably you can just tell about your departments, how many are there, and how things goes in your department, please.
Sure. So I'm actually the director of Student Affairs Department. In that department, we have about 5 units. And one of the units is actually Student Development and Counseling Unit. So here we actually do 2 things. It's called Student Development is because we come up with a lot of development programs. So that's how we reach out to students. Like one of the things that was highlighted by Dr. Zanaki and you were the stigma. So by telling people, going through all these programs that the student development is doing, that it is okay to actually approach the counselors, for this kind of help. And the other one is the counseling. We do have a lot of students coming for counseling, but thank God it's not so much on suicidal. It's more on stress management. It's more on
Academic relationships,
It's more
yes.
coping with academic pressures. Those were mostly the ones that we get at our student counselor.
Your mic should be,
Okay.
your voice seemed to be a little bit
little
low, you know.
little bit,
Yeah, thank you.
So that's what the student counseling and development unit does. Students normally approach us either through our email, which is sa@ucsi.edu.my, or they can approach us through our Facebook, and also they can walk in. Our doors are always open for our students. We are located at Block G, Level 9, and then students can just walk in. We also do have referrals from lecturers, with students with some challenges, and then they come and see us.
Okay, thank you so much, Mr. Kumarish. So we talk about the stigmatization a little bit, It is always, the severity is very high on stigmatization, People or students reluctant to see a counselor or your departments, So how do you like to address this kind of stigmatization so that when, let's say, a student go to your department, it's just fine. There's nothing wrong. I always put this way, if you have a stomach ache, you see a doctor, what's wrong with that? It's just to heal the stomach ache. The same thing, you have a stress severity high, you just go and see the counselor. Nothing wrong with that. How, as you as a directors, would like to overcome this kind of stigmatization? Because I see that is a barrier, and that make your department seem to be not so popular among the students, because they say when you go and see the counselor or the psychiatrist or even the clinical psychologist, you are being labeled as insanity or insane, this kind of thing. How do you address this issue?
So one is the way that we have actually set up our counseling rooms. It's very, very private. People do not actually know that you're actually going for a counseling session. So we have 3 rooms.
But still, I say nobody know. But still, you see, you don't address the stigmatization there, So what do you see? Because you see, nobody see that you are going to the counseling room. That means still the stigma is still ongoing, arising our students. So how do you like to address that thing? That is the most important thing to me, because as a psychologist, I want those who have psychological problem, just freely and see you without having any barrier. So it's open for everyone. I would say that. How do you address that?
So that's how the unit is actually called Student Development and Counseling. So we had programs, for example, that we have just run. Life is Precious, Understanding and Preventing Suicide. We had this talk not too long ago. And normally our talks are always also online, so that, and we get about 300-400 students. And we also open it up to our Bangladesh campus, our Kuching campus, our Spring Hill campus. So students from
all over
any
the
of
campuses,
the UCSI branches can actually go. We talk about men's mental health not too long ago. We talked about, for example, how to manage stress, time management, also addiction to vaping and smoking. So when the students actually participate in this kind of talks, they then understand the people that are doing it are actually counselors, and we are there to help them and assist them. And that's where they then realize that, oh, okay, I have a platform where I can actually go and see them privately. If they are comfortable, and we also do have group counselings with friends. We do manage sometimes when it comes to group assignments. Sometimes they're not getting along, and sometimes they need help. Because one may be doing things faster than the other, and then we do help them in those areas also.
So, just one more question from me just popped into my mind.
Sure.
Is your department open 24/7 or just during the working hours, 9 to 6?
Yeah.
When someone have a problem, it's not just on during the 9 to 6, or 8 to 5, but it can be 24/7.
Yes.
So, did your department have something that 24/7, something like that?
We have 3 counselors at this moment right now, because we also have a psychology center at the 10th floor. But in the student affairs department, and we also have a psychologist in our LB clinic, which is also open to our staff and students. So in our department, in student affairs department, we have 3 counselors. It's headed by Miss Megala.
Oh yeah, Miss
And then
Megala,
we
yeah.
have Z and Win. So we work from 9 to 6, but when in the context of what we are talking about, suicidal cases, yes, our counselors have received calls at 12 to 3 o'clock in the morning, and they do pick up, and they do help the student through that difficult time at that point.
Well, that I can see that your department seems to be a frontliner, on this kind of a student affair. And thank you so much for your your discussion just now. Thank you so much. Okay.
Thank you.
So, well, let's go for our 4th speakers. Dr. Haniza, how are you today? You feeling better after a long journey? I always say that from Shah. Malaysia traffic can be worse daily, especially during raining season. But just now was heavy rain, I would say that. So, okay, Dr. Haniza, a counselor, established counselor in Malaysia, I just want to have this data to share with the audience and you. So in 2022, Malaysia faced a growing mental health crisis with 48,000 calls related to suicidal behavior received by a mental health crisis helpline, or the HEAL 15555. Suicide seemed to be significant in Malaysia lately. The data show that in 2022, 1,087 recorded deaths, and increased from 2021. 2021 is about 981 cases. So, of course, the adolescent is among the at risk on this issue when we talk about embracing life. So, factors like bullying, also increase to commit suicide, and the age is about 13 to 15. And considering the rise in suicide cases in Malaysia, as a counselor, as a representative from PERKAMA, what can you play the role as a PERKAMA and a counselor to so-called like put the mark? We need to value our life because the numbers seem to be increased. And, can you just elaborate a little bit your function, PERKAMA function, and also the counselor in Malaysia to be seen? And we need to come up with the team. Please embrace the life. Please, Dr. Haniza.
Thank you very much, Prof. Thank you, UCSI, for inviting me this afternoon. I have to refer to my notes so that I won't miss anything that is important.
Sure thing, no problem, no problem.
Actually, I'm very excited to be here as I discover this year's theme for the WSP, the World Suicidal Prevention, with the narrative, changing the narrative. I'm coming from the background of qualitative and also English test professor background, I love that part because I think is a good start. And I believe this is going to be our 3-year theme for this matter. And you use the word yes to happiness. The next question probably, who defined happiness?
Yes.
So, and the best part is we can define our own happiness.
Yep.
So nobody going to dictate us how to be happy. Because what is happy for you, Prof,
May not
be happy for me.
Yes,
So
agree.
that's the best part about crafting our happiness. So I want this to be heard by people who are affected, because you are in charge. You take charge of your happiness. That will be my introduction.
Oh, thank you so much. I do like that kind, happiness belongs to the individual,
Yeah.
not to the others who create your happiness. I would say that. I agree to that. Thank you so much. Okay, please.
And I also feel that this is so timely to have the platform to share the narratives. Can you hear me well?
Yeah, just put near to
Okay.
your, to your.
And again, whose narratives?
Yes.
Do I have to change?
You have to, sorry, technical error. So, sorry, Dr. Haniza, okay?
Okay. So, whose narratives are we talking about?
Mm-hmm.
So, we have the persons who are affected. We have the person who are helping, like us.
Yeah.
There are also people who are the caregivers, friends, family members who are there. Sometimes we are talking about these people who are helpless, hopeless, but actually sometimes we look at the caregivers can become hopeless and helpless too.
Yeah.
So these narratives is very important to be, I know it is a taboo to talk about it. You talk about stigmatization.
Stigmatization,
That has
yeah.
been there for a long time, for ages. So to change is not easy, but like I said, having this very day is very important. So we can actually get the, when we talk about the narratives, people have suicidal ideation. So our role actually, when you ask about PERKAMA's role, in Malaysia today, we have more professional helpers than ever. Much, much more. When I first started counseling in late 90s, there's just like we just started. We don't have much problem then, I guess.
Yeah.
But today we have people who can work hand in hand. We have CP, we have psychiatrists, we have counselors who can work together. We just need to create that networking.
Yeah.
We have to be, we have to collaborate. We have to put aside our differences. We have to lower our ego.
Yeah,
We
agree.
have our profession, we want to fight for our profession, but this time around we want to work together.
Yes,
That's very important.
yes.
So PERKAMA is not just counselors. We have, like I said, the membership of PERKAMA may not represent the whole counselors, but today we have actually more than 13,000, if this is correct, the statistics, the registered counselors, we have more than 13K of counselors, registered counselors in Malaysia. We have, 10K.
10K, yeah.
And we have
roughly.
about 13K
K.
school counselors.
School counselor.
Despite the fact people always say school counselors are not good, I have to fight for them. They are well trained.
Yeah.
They are not school counselors. They don't have certificate. They don't graduate from accredited program. They won't be there in counseling. So we have counselors in the community. Right now, PERKAMA has 1,500 live memberships, but we wish that we have more. But it's not a forced thing. Anybody can be with PERKAMA or not. But whether or not you're a PERKAMA member, you are a counselor. We have counselors who are trained. And in our term of reference, I like the question when you say what is counseling, what counseling does. Actually, in our life, okay, to embrace life, if you have problems, you can solve your own problem. You don't need a counselor.
Yeah, agree.
You can talk to a friend, and your friend able to help you. You don't need a counselor. You can talk to your friend. But the minute the problems become with you for a long, long time, that is the time when you think you need a professional help. And again, many times when people say counseling is not helping because they delay the
Process,
effort of seeking help. If you realize you get stressed out or not happy with your life, go talk to the counselor. They are happy to see you, not to say happy. It's their job to listen to your stories.
Okay, yeah,
Their
agree.
narratives, okay?
Yeah, just a narrative of a counselor.
Because you know
Yes,
why
agree.
you need to see a counselor, because they will help you make the early screening so that we can have the early intervention. If there's a need for us to refer for further diagnosis, we'll do that. We send it to you. to the secretaries.
Yeah, the secretaries is
so we
always
pass
there.
it over. The flow should be there.
Yeah.
Counselors will refer. And at the same time, the strategies as a counselor, normally we want to make sure that our client are safe. That is our top priority. So if they are underage, in school, normally we train, I'm also a counselor educator, we train counselors, school counselors to inform the parents. No matter how, sometimes clients say, don't tell lah.
Yeah.
My parents will kill me.
Your father will be so fierce than a tiger. We say
But
that, how
yeah.
can the child
But
talk
I'm
to the
so
parent?
proud of, things has happened before that suicide happened in school, but I'm so proud that all the necessary steps are taken by our school counselors.
agree.
They do the
Intervention,
informed consent. The
yeah.
confidentiality is broken because, and the parents are told, so the necessary step is taken. They are taken to the psychiatrist and all that. And Alhamdulillah, steps are taken. So if, let's say, suicide happened in school, steps has been taken, and we have take the necessary step. So that's the fact that later on, counselors have to do the next step, how to deal with the crisis intervention. So again, when I said we know why there are two things why people committed suicide. Number one, it could be a coping because things are not solved. I want to look for ways to solve my problem. And you know this world today, quick fix.
Yeah.
So we want to add this, the misery, a quick end to fix their personal issues. That's number one. Number two, like I said, the coping, it could be problem solving. I want to solve this problem. It's been with me for a long time. So I don't want this problem anymore. Let me kill myself to end the misery. So it could be problem solving, it could be coping, all right? So, but they are not aware the fact that whatever action they do, it will affect people around them. So if they're with counselors, the counselor will be able to help see that, help them see the whole situation. You talk about bully. It's just not bully. Body shaming, teasing,
So
social
many things.
media. The adult, they have job loss, broken family, broken relationship, family conflict. All this creates stress and anxiety and leading to depression.
Yeah.
And everybody today, especially after COVID-19, everybody get this anxiety, all kinds. So our job is to help them address the feelings as a result of the event, see how they are affected, because the behavior, like feeling alone, the effects of don't want to see people, anything like this can be done for early intervention. So we have to stay proactive. And some of the skills that I think all counselors normally should have, and should do for their clients to coach are, first and foremost is stress management skills. Simple. Semua orang cakap, everybody talk about stress management. And then you talk about skills like, simple skills, teach the client to do the deep breathing and the relaxation technique when you get angry, anger management, conflict management, communication, assertive. I think assertiveness is another thing, but also be aware. Some client cannot be assertive because it's their personality. They cannot be assertive. So be aware that not everyone can do assertive. Can be assertive.
Yeah.
So I have a lot of things to say, but the coping part is counseling matters.
So,
We do help them cope. Sit down with counselors. We work through, and we'll actually discuss which coping is good for you. Okay?
Yeah, agree.
And
Agree.
remember, just one word about coping. We are different, so we cope differently. Is that all?
Oh, thank you so much, Dr. Anisa. Yeah, just one more thing, before I go for the second round. Sometimes, Malaysian is champion in cyberbullying. We just talk on cyberbullying. We are champion, I would say that. Recently, someone died because of cyberbullying. As a counselor and also represent PERKAMA, how do you see this case? Why Malaysia, was so champion in cyberbullying, So because anything can happen in our, let's say, media or whatever, and was blast like no business, And again, it not just about body shaming, and someone can take away the life. What is your response on this particular issue?
Okay, because of the social media, everything will be on social media. You see it today, the next minute it will be on social media. All right. I think it's very important on the prevention part is to educate the community.
Yeah, agree.
That's the least we can do.
Yes.
Communicate. Because I notice also when people can make fun of death.
Yeah.
People can make
Yes,
fun
that's
of
what I meant.
things and
Yeah.
without, respecting the bereaved people. I'm
Yeah.
also doing grief and loss counseling. So I realize that. I notice
Yeah,
the fact
agree.
that there must be social media, the ethical thing that is not, because we can set rules and law, but the ethics, communicating online, for example, sometimes they say things, the keyboard warrior, they
Yeah,
will do things
agree.
a lot, and sometimes they use that platform to make money. So I believe we have to be proactive again and to educate the community all out on the ethics of communicating online, respecting others, especially because I have done this before, Prof. I said this on the online, saying that just to give my thoughts about what happened, and of course I get back
Yeah.
to be
To be
like,
bombarded
why
or
you're so
something.
good, right? But anyway, it's the fact that some people they do not realize that what they are doing is wrong. Hurting people is not wrong, not until they are in that situation. So many of us have never been in that situation when somebody died suddenly.
Yeah, agree.
And they always find ways to say things that they sometimes is orang sekarang kata apa, cannot brain lah.
Yeah, okay, cannot bring. Yes,
So,
I do agree with that. Yeah.
And surprisingly, it's not young people. Sometimes adults
Yeah,
do that
too.
too.
Agree,
So,
agree.
it has to be done slowly, but surely we can do this to educate people in general. More on the ethics. Adab. We are the country with full of adab, but this part is overwhelming to me, and probably we are not ready for this, and we have to be more. This is that the culture that we need to change, and the narratives will come from us.
Sure.
Okay,
Thank you so much. I do have to agree with you regarding on the issue of ethics, the adab. At the end of the day, it resembles the individual akhlaq or the nation akhlaq. Sometimes we don't portray a good ethics, adab, or akhlaq. And that's where, when we talk about this cyberbullying or body shaming, we are good in that. And I'm so sorry to say that we have to do something about it. Thank you so much, Dr. Niza, for your very important message that you share with us. Okay, now let's, ladies and gentlemen, we now will go for the second round of this podcast. Before we go for the second round, I would like to open some time for all the audience. Now, you have anything to say, any comment, any question to the speakers, you please welcome to do so, because we have 4 great speakers with different background. We will try to assist any question that you want to ask. Please do text us, SMS us, or whatever, so that I can take the message after this, okay? So that is for something that we would like to see after the second round of the discourse. Well, back to our soft-spoken Dr. Ann. Okay, Dr. Ann. For this second question that I would like to ask you, young people experiences suicidal thought in today, because today world is, people say a crazy world, but it's not crazy world so much. To me, it's more of the changing world that's so fast that sometimes we can't even catch up, So how do you, as a CP or the clinical psychologist, see the value and the meaning of a life? And what are the best way, to support our nation, our people, our young generation to embrace life, to say that, hey, life is not going to be end by taking your own life. Okay, so, and how to make our society, not to be bullied or to have a cyberbullying until come to take away the life. Dr. Ann?
Oh, okay. That's a tough one, though.
Please. Voice seems to be very soft.
I'm trying my best. I'm trying my
Thank you
best.
so much. I think
I'm
that
trying
just
to
sound better.
emphasizing
Okay.
it.
All right. Thank you.
Okay. I mean, definitely a very broad question. Because as a CP, as a person, as a CP, I myself, let me just speak on my own personal experience, wearing several hats. Yeah, because I'm also a mother. I'm also a sister, and I'm also a daughter, and I'm also a wife. So we play many different roles. As a CP, as an academic, in all of these different roles, we can actually play a very important, we can actually, create awareness, and then also we can educate the people around us. I always say whenever I give trainings or I give talk is that, okay, when people ask me, how do we do this? How do we get people to embrace life, or how do we get people to go get help? First things first is that who are the people closest to you? You can start with them. Like for me, the people who are closest to me are my kids, my children, my husband. So first thing is that I would, start with them first, telling them about, social media, how do you carry yourself, the things that you do, the words that you say to people has to be respectful, and that you should enjoy your life, being an adolescent. Although I don't really like the way that he enjoy himself, like go rumpit, but
Okay.
I never say no. I say just take responsibility, but you do enjoy, but at the same time, do take responsibility in that sense. And for for my student, okay, student for us academic is very important. They are our legacy,
Yeah.
whether we like it or not. We try to inculcate and nurture them to be advocates for life, obviously, and then also for people to seek help, because we're not just looking at preventing, we are looking at people's mental health to thrive. Because right now we are actually, cleaning up the mess, and then sending them to see Dr. Janaki to give them medicine. Okay, we don't want that. We want people to come so that they can,
Feel free.
improve their health. You don't have to, think about to the extreme that you are already feeling like you want to kill yourself. But before even get there, just go talk to someone. So advocate among our students for our future, because they will be the ones meeting clients. And then for talks like this, we create awareness about importance of life. Why do we need to embrace it? Why is it important for us to make full use of the life that we've given? Because at the end of the day, we all have a choice. I'm talking about choice therapy.
Yeah.
We all have a choice. Okay, we all have a choice that you can choose to enjoy life as a current where you are now, make full use of the things that you can do, things that you can achieve, rather than thinking about the past or thinking about the future that never happened yet. You are working with what you have right now. So sometimes people say, okay, when life gives you lemon,
Oh, okay.
you make
Lemon tea. Orange
orange
juice.
lemonade,
It's
orange
a
juice,
lemonade.
lemonade.
It's a lemonade.
Okay, it's not just make lemonade. You can make lemon meringue
Yeah,
or
yeah.
lemon jam
Yeah.
or cake. So there's even life. Throws you lemon. You can still make so many things because you have a choice. But when people are in that situation, they can't think of any.
Yeah.
Therefore, it's very important that we are aware of our family, our friends, our colleagues who may be going through something. We reach out to them first. They might be scared to ask for help, or they just don't know how to ask for help. So we are aware. We reach out, put out our hands to help them, and that's the first step to create that awareness that you can count on us. You have our support. We are here for you. Most of the time they feel lonely because they don't know that they have support. They never ask. So when we're aware, we put out our hands. We don't have to wait for them to ask. We go out to them instead. And to me, that is the first step among yourself, among your family, among your friends, among your colleagues, and among your workplace, among your students in academics, and then among our collaborators. And then among PERKAMA. I'm also a lifetime member, just so you know.
Okay, Dr. N. I like the way that you talk about we have a choice. Laminate can be another things. But at the same time, we have to really understand the individual differences. Some person, may not like to talk, isolated themselves, because today is what they call it, Generation Z, or what, millennial, or what they call alpha. Oh, now it's called alpha. They don't want to talk. They don't want to talk to human. We are all the old school thought, We always believe that the human touching can really change a lot of people's behavior. But how, as a CPC, because we talk about the embracing life, but at the same time, our alpha, Gen Alpha, is it? I thought it's millennial, not alpha. Where's you go? But yeah, I was old just. But how these isolated things and being alone and does not have a human touching. It's not that I disagree with the AI or artificial intelligence, but I always strongly believe that, the human touch can really make a difference. But with this kind of scenario, people go for gadget, people go for this kind of AI, they lost the touch. And how you want to bring back that choice, that we are all human. We need to communicate to human, not just to the gadget or to the internet or the AI. Today world, you ask AI, everything have the answer. They don't need human. How do you see as a CP on this kind of issue when you talk about the choice just now?
Yeah, I mean, I can't deny the fact that with, during our time, we don't have this. Mobile phone was coming in at 97, okay, just so everybody
bell
knows.
bottom there, is it the
Nokia
curly hair?
3210, okay. Therefore, we have to, again, embracing life, we also have to embrace AI, technology. We cannot not live without it.
Yes.
But at the same time, we should not lose that humanistic touch as well. With these children, this Gen Alpha, Gen Z, they were born in the year of technology.
Yeah.
Okay, if you ask them, have you seen this cassette player? They think, what? How do you play this thing? It's so weird. So, to be honest, it's not an easy thing to separate that. But how do we live together, but at the same time not losing that humanistic touch, the human touch, I would say. And as a parent, I think it's very important that we also are aware of the impact of our children growing up with all this technology, that we need to also make sure that we are still, form an attachment to our children, to tell them that, at the end of the day, as much as you are very much involved or engrossed in the AI, because kids nowadays, they play Roblox, Discord, they talk to whoever online. And I'm also surprised in a way that, yes, it can form a social support online, but in sessions that I have with my clients, I do encourage them to start socializing more. Go out there and try to socialize with other people. You still have your social support online, but you still need to have physical social support too. And if you're having a hard time with your family, then your friends are there. Just go out and, mingle and socialize and try to get used to it, because we can see the effect of the pandemic. Yeah, so there's a generation that actually started university. Their whole 3 years are actually online. And they have a really hard time going out and finding a job because they haven't spoken, see people, let alone attending a physical interview with their HR. They just don't have the confidence. They're not behind the keyboard. You can be whoever you want. You can say whatever you want. Nobody will judge you. And they're okay with that. But when they go out, they start to think, people are going to judge me. Prof. Zahari is going to judge me. Things like all this time behind the keyboard, I'm answering all these questions. It's all ChatGPT. Now he's in front of my face asking me, I cannot ChatGPT. He would think I'm stupid. So all of those things happens, and that's just facts. This is what we're seeing in the generations post-pandemic. And we don't want that to happen. Therefore, we need to make sure that there are physical socialization among our children. And I encourage my kids to go out. I say, you go out to see your friends, don't rumpit, but you can. As long as you see your friends and there's a balance. That's the part that I think we need to also educate parents to keep that communication, keep that relationship, keep that attachment going with their children, the bonding, the quality time, you name it. They need, at least they have some human connection with you. If they don't even have connection with you, let alone with other people.
Yep.
So it has to start from home, whether I like it or not. This is just facts. You know, we all have children, we all parents, and these are very important for us to be aware in terms of how good our relationship are with our children. If it's not, how can we do to improve it so we can bring them and balance it out with AI and also modern technology. That's my take on this. As a CP, I would say to the parents when I am seeing their children, because obviously parents send their kids to me because they say, please fix my child, there's something wrong with them. So I would say, you caused this, okay? And you want me to fix it? No. You have to come into the session with me as well. I need to have a session with you because there's definitely something wrong why your child is behaving the way they're behaving. They just don't come out like that and behave that way. Must be something going on here. And I need you to be in here to work this together with your child as a family. It's not going to work just working with your child. I can't fix your child. I'm not a repairman. I need to fix this relationship, and that's involving you. And that's usually my approach with family who comes in with children that they think is broken. Bring the family, parents, mom, dad, I don't care, come here, let's have a family session. And that's how I approach this, to make sure that attachment, relationship, whatever the systemics happening in the family is being addressed so that they can see that, okay, the child's like this is because things are not in balance with the family.
Oh, that is really hard work. So I always say that.
Yeah, is that
You
off
don't
topic?
feel tired. No, it's not off topic. You are good. I mean, you don't feel tired listening to the human problem. Just before, I'm just.
You want the honest truth?
Yeah. I'm just asking you because that's where I don't want to be a CP or a counselor at the first place because I don't have a patient, but I was really admire, with the way. Do you feel tired listening to human problem?
Should ask Dr. Haniza. She's been in business for longer than me.
I'll come to Dr. Haniza before that. Okay, but to you, I
guess to be honest, wanting wanting to help people has always been something that I guess it's very innate. I've always, even before I became a counselor, I wasn't a counselor before. I was in a public health, definitely in the prevention area. Then I went into counseling and then become a CP. So I think I've always been, a field type person, always engaging with the community. To me, if I can be a listening ear to someone, and that makes a lot of difference, just to lift a little bit of burden from their back, just listening, and it draws a smile on their face. To me, that's satisfaction.
Okay.
I'm more than happy. Not a single dollar in the world, millions can give me anything but that. But not to the point I burn out. Okay, I think self-care is very important.
So, thank you so much for your genuine answer for that. That's where we have individual differences. Okay, so let's go for the online discussion. Dr. Janaki, are you with us? Dr. Janaki, are you with us?
Yes.
Oh, can you hear? Oh, yeah.
I can still. Okay, lovely sound from
Janaki. Okay, Dr. Janaki, as a psychiatrist, you see, just now you heard from a counselor, you heard from a CP or clinical psychologist. So as a psychiatrist, so when someone talk about suicidal thought, and acting on the issue of committing suicide, is it true that when someone begin to openly talk about taking their own life, is indicate they are close to do that action? Meaning that when someone try to talk, to have in mind to commit suicide, is it true that they're going to take away the life? And that's where, for today's podcast, you must remember, we need to focus on embracing life, value the life. When someone start to talk, taking away the life, they will jump from the building, for example, okay? And how to differentiate someone who are at the higher risk and someone who really need a seeking support. So is there any psychological factor that take place during this treatment? Dr. Janaki.
Dr. Janaki.
Okay, Prof. Okay, so that is quite an important question. So there is this this misconception that when someone talks to us about suicide, so we think that this is going to, I mean, they are going to commit suicide. Okay, so this is actually a myth. Okay, it's actually a myth because in fact, several researchers and many researchers have shown that if someone, that someone is asking us about and they're talking about the suicidal thoughts, it's actually more likely we are going to save their life. Okay, so we are going to be a platform for them to open up, for them to actually talk about their suicidal thoughts. It doesn't mean that if someone asks about suicide, they are going to commit suicide or they are going to like take their own life. Okay, so this is actually a myth. So by right, when someone asks, okay, so when someone asks, it is more of like they are trying to open up. Okay, they are trying to open up and they are trying to seek for some help. They are trying to seek for some help for them to come out of these thoughts. It doesn't mean the other way. So this is a very good question, and it's there in many people's mind, and this has been going on for some time that people are thinking in that way. So, and sometimes they can also, most people are thinking about suicide and they are ambivalent even about taking of their thoughts. So when they open up, so we can also have a human touch, we can make connection with them, and then we can build a rapport with them, and they will be more forthcoming to share their issues with us because they know there is somebody to listen to them. Sometimes they are quite afraid, or because of the stigma, they feel like they cannot reveal these things to their parents or those they are close with, because in the sense of they will be being condemned, or the family might put them down, say that you don't have a strong this one motivation, or you don't have a strong self-esteem, you are a very weak person, and this will like further add on to the trauma or to the stress they are already facing. So when we are there as a listening ear to them, so they will be like more freely, or they will slowly try to bring up the issues. They will try to talk about their problems because they know that someone is for them. So that is, so it is like we are helping those who are or not, they will be suffering in silence. So this we encourage them to speak up and reveal the problems, and we can help them to whatever extent that we are capable of doing. We can give them a lending hand. So so about the next question that Prof was asking about how we want to differentiate those who are at higher risk of attempting a suicide or having a suicidal thoughts. Okay, so when we see, so when we go into the history, we usually ask them about a past history of suicide. Okay, so if they have a past history of suicide, obviously they have a very high risk of committing suicide. So we have to be very careful. They go into the high risk group. Also, we have to ask about whether there is any underlying comorbidities of other psychiatric disorders. Because when they have psychiatric disorders, comorbid psychiatric disorders, even this can increase the suicidal thoughts. Not only depression, even psychotic disorders like schizophrenia, especially in schizophrenia, when they have auditory hallucination, in the sense that others are telling them to go and kill themselves. So they feel very distressed, and because of the voices and also because of feeling distressed, they are pushed to take into the act of committing suicide. So we need to ask about underlying psychiatric disorders, as well as it goes with chronic medical illnesses. Okay, so if they are suffering from chronic medical illnesses, that also can increase the suicidal risk, especially those with severe debilitating illnesses. Okay, for example, having a cancer. Okay, so these things, or having stroke, all these things can even predispose them to even think of a suicide. And those who are also taking like misusing or increased amount of taking alcohol or other illicit substances. Okay, so we have to ask about that history also, because this could have increase the risk of suicide. On top of that, if they have recently had a very, stressful life events, okay, maybe they lost the spouse or they lost their children, okay, so this also, they can have the thoughts of even ending their life because because of the grief. And when the prolonged grief, it can also predispose them to have these suicidal thoughts. It's more of a passive death wishes that they want to join the disease. So we have to also inquire about their any stressful life events, and also if they have suddenly lost a job, so they will be losing their income. So the financial parts, so they might be the breadwinner of the family. So when there's a sudden loss of job, so this can be a very stressful event to them. So also those living in the urban areas. So all these things can, these factors can contribute to someone to increasing the suicidal risk in this group of people. And also if someone has already planned, and we have to see if they have planned, they have an organized plan, which means if they have an organized plan, they have thinking of suicide for a very long time. So they have already searched online materials and all that. What are the methods? And if they have, in fact, attempted a suicide, we have to look at the lethality of the method, because some methods are more lethal than others. For example, like hanging yourself, okay, or even like carbon monoxide poisoning. Okay, so they are more lethal than as compared to they are taking the drug overdose. So we have to see the method that they are employing for the suicide. So that also, and obviously the family support. So those who come from a broken family, or those who have a past history of any forms of abuse. So they also have a higher risk of suicide, having suicidal thoughts. So these are the higher risk groups. So and what are the psychological factors that they are involved? Okay, so when we look at the psychological factors part, so again, we need to assess them. So for example, even in depression, we have the physical factors and the psychological factors, because the symptoms do that. So in depression, in order for us to diagnose a patient with depression, so we look into the factors such as, for example, like low mood, loss of interest, okay, feeling of hopelessness, worthlessness, loss of concentration. These are all the psychological symptoms. And depression also has the physical symptoms, which is the change in the sleep pattern and a change in the appetite. They have a poor appetite, or they are eating more. So these are the physical symptoms. So sometimes the physical symptoms and the psychological symptoms do overlap. So we have to differentiate even that. So these are more of the psychological symptoms. And also just not only depression alone, even in bipolar disorders, when they are having the depressive episode, or even in the manic episode, they can also have these suicidal thoughts. So we need to look into so we need to have a thorough history, and we need to do an assessment on the mental state of the patient to see what is the current mood of the patient, okay, and whether patient has any underlying psychological issues, so which can contribute to the suicidal thoughts.
Okay, thank you so much, Dr.
Just something that triggered me when you talk about the layman, usually the layman will like to associate, you are weak. And because you are weak and you like to commit suicide. This is what the layman used to say, I still believe that even how strong you are, how good, stable you are, you also have a risk to harm yourself. So how do you like to see, and the layman would like to see you are weak, and because of you are weak, then you want to commit suicide. It is a myth to me too. Am I right? Or you want to have another option on that? Please, Dr. Janaki, because I really enjoy when you talk about the weak people and committing suicide there. Thank you, Dr. Janaki.
So this is
Okay.
also this is also one of the frequently asked questions. Yes, so like suicidal thoughts are more commonly associated with like you are being emotionally weak. So because you are weak, you can't handle your problems. So when you can't handle your problems, then you resort to suicide. So this is what that has been. In the society, these thoughts are quite rampant. So they frequently is being associated to weak. But we don't understand. It is not really weak, but the person is having some emotional issues or some underlying issues and some underlying unresolved conflicts in life. That is the one that brings up to flares up to these suicidal thoughts. So we have to go deep down to know, to explore what has happened in the life of this individual, what has happened in the past. So what has resulted in this suicide? So again, we need to look into the risk factors. We need to know what has been happening in the life, or was there some recent stressors that just came up recently? It was not from the past, but recently something came up that put this person emotionally like really affected, in the sense that he can't. And when a person is emotionally affected and they tend to keep the feelings to themselves, so this adds on to the burden. In fact, when the person shares the emotions with others, things will become a bit more relief for that person. So we have to look into the underlying issues. So the core problem, what is the core problem? That is the one that is affecting this individual. Because if we can look on a way to solve this core problem or assist this individual on handling this core problem, and also uh, find some other ways, or what are the other coping styles. We work on the coping mechanisms, how we want to cope with the stress or how we want to handle this problem. So we look into that, that is going to help this individual to become to be emotionally more stable, and to make a rational judgment. Then he himself will start to realize that resorting to suicide is not the way out. So there are many options for me. So we have to make that person realize that there are a lot of points to live in this world rather than taking your own life. Okay, so this is the theme for today, embracing life. So we should be embracing the life. So this
Okay,
is
thank
my
you so
take,
much.
Prof.
Okay.
Dr. Janaki, lovely thought from you, So, Mr. Kumarish, we talk too much on on technical part. It seems that you are swinging a little bit, You are from a student affair. So let's listen from a student affair. As a student, as a director for student affair in UCSI, how the department handles suicidal case and the follow-up to embrace life among UCSI students.
Just before that, Prof, I think listening to all the doctors and professionals who are actually speaking, I just want to highlight to the audience out there, I think it's something very important. Sometimes I think, just sitting down here, this just came to me, so I'm just going to share it out. Please do correct me. I think sometimes when the people who are going through this situation, they don't know whether or not they are making the right and wrong decisions. But the loved ones, so those people who are online and people who are listening to this, listening to like Dr. Janaki and Dr. Ann and Dr.
Anissa.
Dr. Hanisa, I realized that sometimes they are in that situation, they may not realize that they're going, but the loved ones, their friends around them, should be also observant and realize that there are changes in their friend or their child or something like this. Because I think sometimes when you're going through this kind of thoughts or depression, you don't know.
Yeah, agree. I do have to agree with that. Yeah.
But the people who are closest to you will realize that your behavior has changed. and
Mhm.
their attitude has changed. And then these people also should react. So by listening to our podcast today, I feel that the loved ones also play a very very important role
Mhm.
to you know immediately attend to things like this. If
Yes,
they are
agree.
really observing
Mm.
their child is like that, their friend is like that, their brother, their sister is like
Mm.
that, then you have to sometimes, because they may not want to look for help.
Yeah, agree.
You know?
Agree.
So yeah, I just wanted to highlight that point. So coming back to your question, Prof, about student affairs, again, our approach is always to reach out first. We come up with all kinds of development programs. So I encourage whoever students who are listening to our podcast to participate. We do it online, so we don't have limitations in terms of the number of people. Normally we have about 300-400 students, but we can even have more.
Mhm. Yeah,
And
agree.
by participating into these kind of programs, you might, and I feel you will surely find it helpful, because we do a survey after that, to get
Mhm.
the feedback from the students. We always score like a 93%, very satisfied about the whole talk. So I would encourage more students to come to student affairs. These information is e-blast. It's in our Facebook, social media and things like that. But sometimes, if you don't know, if you still want to come over, please come over, and then we will tell you
What to
kind of
do about
things.
that?
Yeah.
Okay.
Yeah.
Okay, Mr. Kumarish, I just popped into my mind after listening to your discussion. I found that you also have a lot of program that really attach or targeting the UCSI student. So, as a director, which program really matters on this Embracing Life that come across to you as a director, and we should promote this, to become a benchmark, saying that, well, we have this kind of program, and this is very good, and really success, and the engagement with the students are there, and the most important thing, the student understand the importance, the value of their life. Any program that during you as a director.
I think every individual has their own sort of interest. So that's why in the beginning I said student affairs, we have 5 units. So one of it is actually student development and counseling, but we also have sports and fitness. So sometimes through fitness, through sports, you get involved in something like that, uh, then you become passionate about it. You meet new friends who share the same kind of passion, and you start feeling good about yourself. You're by exercising, for example, your body starts to become stronger, and you see the changes. It's not immediate, but it's also something that it's inspiring, because it shows that you can do something. Like going to the gym, for example, you couldn't lift like a 5 kilo dumbbell, right? But after 3 months, now you're going to 7 kilos, or now you're going to 10 kilos, right? So those kind of programs. So under Student Affairs Department, there are many units actually that they can participate. Another one is our um, student recreation and activities. So we have 96 actually active student clubs. Yeah, so students can participate. There's so many participation. And talking about today about technology, we even have esports club, right? So anything that it's relating to your current generation, we do have all these kind of activities. If they are into anime, we have anime cosplay and all those kind of things. So really, I think the first step is always trying to seek help. And sometimes, like I just now, listening to, maybe you don't know that you need help. But the loved ones, your friends, if you notice that your friend needs help, I think bring them to student affairs. We have many things that they can join. We even have like student volunteerism program. We have student volunteer program, every month we go out to KL City. We work with Kachara Soup Kitchen, and we feed the poor. And sometimes we find this is also very helpful because they start realizing other people are in a worse situation than they are, and then they start giving their time, and then they start feeling better. So there are many programs, under student affairs. If they come over, we can actually help them. Yeah.
I like the ideas of, reaching the poor, because you will understand the meanings of life in our today worlds. So, well, I have few questions from the audience, but I will handle the question later on, and I will try to pass to the speakers. Before that, okay, we would like to listen to, from our speakers, Dr. Aniza. So I just want to ask you regarding on this issue on positive thinking. It's not that I disagree with the positive thinking. So people can say be positive, smile, laugh, be happy, even though you are hurting inside. Don't you think that this kind of positive thinking, if you too obsessed with positive thinking, is a mental trap? And before that, okay, that is just the first thing that I would like you to respond. And before you respond to that, because I see that, when you talk about the positive thinking, it's a mental trap to someone, but most probably not to others. Because you trap your mind, even though you are hurt so much in life, but still smile. Some people say, Prof. Zahari always smile 24/7, even though he was hurting. Nobody knows. But still, is that positive? But that thinking trapped me sometimes. So again, in your experience as a counselor, I always believe, beside positive thinking, the mindfulness mind is also important. Not just mindfulness mind, but to me it's a growth mind. We need to develop the growth mind to balance up, because life is not about positive issue. It may come with a negative element within our life. So how do you see that positive thinking is a mental trap, and how to promote the personal growth mind or mindfulness mind? Dr. Anissa.
I like the question very much, Prof. I think I've been dealing with that for.
Your mic, please. Can you just again? Thank you so much. Okay.
I like the question very much because this is the thing that I think I've been dealing with clients in the session. It's easy to say stay positive.
Yes, stay positive.
And be mindful. I think the mindful part should come from us, especially the mental health professional, because sometimes looking positive on our part can also be harmful to our clients. We look so positive, we say everything is possible, you can change, and we've been, that's in our profession, we have to stay positive. But the part that someone we're helping in to think positive in a very chaotic world is almost impossible. Okay, and sometimes it require we need to give them some space. All right, and I'm not yet talking about some overthinking clients. All right, and this is very dangerous actually. We have, and these are the people who are smart people, who are very intelligent, who read things, who actually self-diagnose themselves. And I say, okay, you got the diagnosis, okay, all right. So sometimes we have to. How do you communicate with these people? Because nobody in this world will just sit down and we have to give them the benefit of the doubt. People who are affected, they do something to improve their situation. So as a counselor, normally I will find out from them what they have done, whether it's working for them. If it's not working, why it's not working. We help them to assess, evaluate the step they have taken without dismissing that this is not right, this is not wrong. Why don't we just explore the challenges they face? Okay, I said, do brisk walking. I have talked to someone who actually in the room for how many months during the COVID-19, and I said, okay, why don't you first, your curtain, you open the curtain, open and, okay, this person has been living in the dark, and stress and anxiety, and they're comfortable with it. I'm okay. It's okay. I don't need to. But yeah, I don't. It's just the sign like I said. Okay, the next morning, can you try something? Do the brisk walking. They said. This guy said, no. I did. I try. So many stray dogs. So sometimes you have people who have distraction, and how do you want to deal with it? Because you want them to stay positive. You give them some ideas, and it can be frustrating on our side, right? We have to admit that sometimes parents also get very frustrated with and it's easily for us to say this is attitude, but you have to remember some of these people maybe they're taking medication, and the effects of medication, the fact that the effects of, and I have someone who I thought that always go to the toilet, and I thought that the person must be smoking or something. It turns out that after taking the medicine they got diarrhea. So you have to understand the effects can be different. I'm not a doctor, but I've observed this in the clients. Anxiety pill is not as bad, but the effects and takes longer. They are at the peak of the lowest energy ever. You ask them to pick up one little things on the floor, it's difficult for them. So I think in counseling we are now focusing on self-care. The self-care is very important. So I heard all the doctors and also have mentioned about all the coping and all that. We can go as basic as like, yeah, I agree. Physical self-care. Make sure you eat. Make sure you get good rest. Make sure you get good sleep. That would be a good start, having good sleep. Because these people say, I cannot sleep. But all that they will stay up burning the oil at 3 o'clock in the morning. And you have changed your body system. Our body system is actually natural to act to the situation. So, but again, we have to actually suspend our judgment on them, because to recover is a slow process. Okay. Sometimes in counseling we look at emotional self-care, addressing you're angry. Let's see, where did you get that anger from? From whom or from what? Okay, we talk about that. And then sometimes we check on the moral self-care, because there are people who hurt themselves, harm themselves, and this is moral decision. Okay, and that there are people, we talk about support just now. Support system is good, but sometimes you imagine these people who have self-harm, they are most vulnerable, or they will do that in college at the university. I'm also the deputy dean for my student affairs, so I can relate to you. So this is the time towards the end of the semester, and you need help from your friend, and your friend get traumatized because you self-harm in front of them. So these are another thing we have to know, how to protect our client as well as to protect people around. And the support system, easy for us to say that get your support. Who are your support? Sometimes the person whom we thought can be a support can also be a culprit. So really have to be careful with this. So and again, to think positive, I will say always be mindful of myself, and explore with the client. If I don't want to say the word think positive, but try your best to, as counselors normally they have ways how to change the faulty thinking, how to start plan, what would be the positive thing, how do you change your the negative feelings to the positive feelings, and all this, because you are not immune to challenges. Okay, sometimes watching Korean movie is good. Watch movies. So sometimes doing movie therapy is another thing, but you really have to be careful and screen the movie. Okay, and I think self-harm, and sometimes it's easy for us to say, okay, for example, someone harming oneself, we ask them to stop. When I first started working on self-harm, I do that. I said one of my treatment goal will be to stop the self-harming behavior. But later on, I discovered how difficult it is to stop. I'm not saying that they have to, I'm encouraging to kill themselves. I'm just checking on them first. Is it non-suicidal or suicidal? They have different steps, right? So, but again, help them find the alternative. Sometimes they don't have any new coping, so we help them find a new coping. So that, like I said, it's not easy. one of the things we have to do for ourselves is to make sure that we realize that I have listed a few new skills that may be very helpful to people. The ability to accept the possibility a long lengthy journey to recover. How many of us have that patient? Okay, sebab tu orang kata counselling ni slow lah. You don't. It's a process.
Process.
So
I don't say the word, I don't use the term lah. I wouldn't slow. I rather say that it's a process, it's a journey to identify ourselves. That is not an easy process.
you're in the profession, so you know.
Yeah. That's what I don't like to word the term
Yeah.
slow, because to me slow seems to be not energetic enough. It's just a process. It's a journey that someone have to face on during the counseling session. I would say that.
Yeah, I'm just responding to people who say that after
counselling is
it's
slow.
not working.
Yeah.
So you don't come one day and you get panic. You don't get like you eat Panadol, you get
Yeah.
your fever will be gone. So it is a long, it's a process.
It's a
So,
process. It's a process.
So that the ability to accept things that cannot be changed.
Yes, agree.
Immediately. So you probably there are things that the ability to accept and cope with the situation you cannot change, because some things are irreversible. So you cannot make any changes. So people talk about resilience, but resilience is not overnight. So all the thing that you do is the ability, because some people the hardest part is to accept things they cannot change. So this is the part that we can negotiate now with your client. And I think caregivers, please, also this is another thing I beg people who are listening, the caregivers, you probably also need counseling, not to say that you all have problems, but how to help you with the self-care, how to help you to develop that compassion, to be able to accept the fact that it takes time to recover. The fact that you are there, that gives already therapeutic to the client, because sometimes we can easily give up. Friends can easily give up. Like I said, when you need them most, they are not there. And we have to take this part to the client, to anyone who's affected by challenges, to take charge of themselves. There'll be time that you need Dr. Aniza is not there. You need your parents, they're not there. And you start thinking, they don't love me. Okay, so these are the things that always come to their mind. So help them to be independent. Help them to start take charge of themselves. So be responsible of things. What do you want? Let them, have the authority to decide where they want to go, without going to the idea of having suicide. So sometimes in counseling, I believe not just prevention. You have to also, some people, when they have ideation, how can we stop them from having that ideation? When they have make any attempt, how do you want to stop them from attempting again, so that we can prevent all this? Inshallah, I think that's from me. And this is it's a very hot topic to discuss at this hour. And I'm thinking about it can, I don't know whether people can accept this so many things, but inshallah we take it slow. I mean, like, take one thing at a time. It's a process.
Dr. Aniza, I don't like the word. It's not so energetic when it says slow, It's a process.
Slow and steady.
Yeah, it's a process of.
It's a process.
Yeah, it's a
Okay.
process.
So inshallah, take one thing at a time. Be mindful of things that we can do, we cannot do.
Yep, agree.
And if people say things to stay positive, you have to have the courage to say that you have to say that I own this problem and I want to do my way, and doesn't mean that it's negative. Okay, so you have to negotiate on that part.
So lovely. Thank you so much, Dr. Aniza. Please hold the mic for a while, because I received quite a number of questions from the audience, sending via SMS and also text, and also to the Wellbeing Research Center. Well, just one question that really triggered me, or looking at the questions, okay, from someone, I don't have to mention the name, He said, what is the red flag for suicide? And I think as a counselor, I think you can share certain things. What are the red flags, So that, because at the end of the day, because our podcast today is about embracing life. So when we have a red flags, how you would like to make sure that we can really handle well, and at the end of the day, saving life.
Okay, I think we talked about time when I do training with Roman. So this is his forte actually. But anyway, just to name a few, I think we mentioned about changes in behavior. Changes in behavior is a good sign. Coming from someone who's jovial, suddenly become very quiet. Someone who like to meet people, suddenly stay in the room, don't want to meet people. Who's suddenly become. Sometimes the changes can also be in classroom, for example. Someone who's quiet become very acting out. Those are some of the signs. I also have experienced people who say, oh, berapa kali dia kata nak mati, Sometimes people make fun of it. So we have to start take it seriously. The minute say I feel like killing myself, and we have someone make a statement on the social media, and people make fun of that. And remember in Sarawak, I think once before, and that girl or guy, I don't remember, jumped in the lake. So this is something that you cannot take. You have to take every single thing as serious matter, right? So because if you notice that your friends make some changes, change abruptly. If you notice your family member is the changes that you need to take note. Someone who say that I self-harm myself, since most of these people, that people starts now in the research as early as 9 years old, and we also have kids committing suicide as early as in primary school. I don't remember. So this can happen because of the media, because of their watching things, and people are. Because of the subject we cannot control, but we can actually still educate them the rights and the wrong. I said about moral decision just now. So red flags is important to pick up. I cannot. This is just offhands, but I also want to mention that if you think that anyone who's listening and you want PERKAMA to go just come and help promote mental health, create awareness on this, just you can invite us. And if you think you have someone who actually in struggle, you have the Talian Heal, that's actually from the National Center of Mental Health, and it's wonderful thing that we have this center led by Dr. Noor Ashikin. Then we have also, if you notice, when was the last time you see your My Sejahtera? There's one feature in there. It's called My Minda. That's very important, that you can actually assess your mental health. And there's a lot of informative brochure in there. So actually, we are so lucky in this country. We have people who react to mental health issues. But again, we are struggling because the statistics keep on going up. But it doesn't mean that we don't do anything. All right. Okay, so if you do all the coping, we have spiritual coping. The Muslim probably do the prayer, zikir, and all that. So I think other religions will do that. So just look for the coping that works for you, and talk with someone. Maybe you can exchange the ideas to cope better. So red flags, inshallah. The Minda Sihat in school, they have red flags. School counselors, we pick up those people with red flags from the PHQ 9, I think, and another one, they will call these students and do the training. So inshallah, our school counselors are trained to pick up all the red flags from the Minda Sehat in school. So we are okay actually. We just need to work harder to promote better.
Thank you so much, Dr. Riza, for your really well explained on the red flags. Okay, I would like to ask, there's also one question from the audience. I throw the question first, and then I look who's going to answer, whether it's Dr. Janaki or whoever. Let's say there's one question that really nice to be discussed for today's podcast. How do kids grow up to become bullies and cyberbullies and a bad person in general? Dr. Anne, you like to respond to that? I do agree that this is a very common thing that takes place in our daily life, So how the kids, all of a sudden grow up, become a bully, cyber bullies, and they become a bad person.
I think there's a lot more factors that needs to be considered when we talk about how people go through life. From a young age, and also as an adolescence, as also as an adult, the transition, we're looking like, for example, the theories of lifespan development theories, many different theories about behaviorism, social learning theories, and also how their experience growing up, in what kind of household, you know, the types of parentings that they experience and whether they experience any trauma as well. Like for example, if you ask me, there's this study called A study, adverse childhood events study, where they follow up children from many different households, those who are growing up in institutions and those grow up in homes, proper homes, and then they follow them through for the rest, like 30 years, a very longitudinal study. They found that children who grew up in an institution like orphanage and whatnot, and then those who grew up in a you know, violent or abusive household, they ended up with having higher risk of developing depression, anxiety, or schizophrenia. So,
Yeah,
and then
agree.
also, you know, I think Dr. Janaki will probably know about this as well, that they also have a lot of chronic non-communicable diseases as well, just like hypertension, heart problem, diabetes, you know it. They are more prone to having all of this compared to those who grew up in a very loving, very safe, very secure environment, in a loving home. And that itself tells you a lot in terms of studies that's been shown. That's evidence-based. So if you ask me how a person grew up to be the person they are, these are the factors. You know, there's no specific one factor. Okay, you have this, then you grow up to be like this. Nobody can predict that. Life is unpredictable. So what are they being exposed to? But you can grow up in a very, you know, difficult home. You know, you have a difficult childhood, but you grew up to be a very successful person.
Yeah.
So you cannot say, okay, you're like this, you're going to grow up to be like this. So it depends on what are your experience growing up, who are your role models, who are the people that you are exposed to, and what are your experience. Did you have a good you know, home growing up? Or I think our generation, correct me if I'm wrong, we grew up in hostel, boarding school. Our parents said that, oh, easy, send them to boarding school, let them grow up there. So most of us live quite far away from our parents. So we also come up with, you know, some sort of issues as well, like maybe there's no emotional attachment and things like that with our parents. But we work it out, we work it through. The most important thing is what you do to improve yourself, to make yourself better. Not everybody is born to be a bad person. As a Muslim, when we were born, we're like, you know, white cloth, right? No sins. Is what we go through life is the one that that put patterns in our cloth and makes us the way the person that we are today. So to answer that question, I can't really give you an exact answer, but I gave you an overview answer. So I hope that helps.
Well, and that is also a relevant answer that we need to see, because individual differences make a difference. So to make someone turn into a bad, there's a lot of factors. It can be environment, it can be so many other things that take place, especially today world. Well, I think we will come to the end for today's podcast. And it's a very lovely discussion, I said, from a different background. So before we end our session, I really hope that for each speaker to talk 1 minute take-home message. It's just a 1 minute take-home message, because our topic today, you know, is about embarrassing life. It's about how important life and value of life. So for that, I would like to start with our Dr. Janaki, please. 1 minute take-home message, embracing life for today's podcast. Please, the screen is yours, Dr. Janaki.
To start, okay, please. 1 minute take home. Are you there? Hello, Dr. Janaki. That's some.
Yeah. Okay.
Okay. I just
there was some technical
finish up.
problem.
Sorry. Before we end up, I just want to
That
share this thing
hopefully
that
I start with you to have 1 minute take-home message, embracing life. You know, so the most important thing is we need to value life. Okay, before I come to 1 minute from the host today, please, Dr. Janaki.
Janaki.
Okay, yes, it's true. Our theme today is embracing life. So those who are having any issues, any problems, they should open up and they should seek for help. Okay, because life is precious and and suicidal thoughts can be overcome. Okay, just that you need to go to the correct channel and the correct path. Okay, so that is my take-home message. So so to always open up, talk, speak, look for help.
Janaki and Mr. Kumarish.
Hi, thank you, Prof. So mine would be life is precious. Remember that you are loved. Uh, Around you, around us, there's always one person, at least one person. So before we make any rash decisions, I think always speak to that person. And if really you feel that you can't speak to anyone, remember that God loves you, and you are His child, and there's always a way. There's always a way. So do not make any rash decisions. The world is very beautiful. It's just a moment, so don't make any rash decisions.
Mr. Kumarish. Okay. Dr. Haniza, please.
Okay, I think next month, in October. October is going to be counseling month. So, inshallah, mental health month for the counseling month for Malaysia is Mental Health Day on the 10th of October. So, inshallah, we have more activities that will help you manage yourself better, whatever. To me, mental illness, the one thing good about mental health issues, it is not there forever. Someday whatever happiness you want, it is up to you to make an effort to build yourself, your personality. Life is not challenges in life you cannot avoid, is preventable, but making changes to your life is possible. And I'd like to also announce that coming soon, PERKAMA will be having a conference that is focused. Our focus today, this time, will be on the well-being and workplace. So we make sure that everybody, even if you're at home or at workplace, counseling is there for you. So we also welcome anyone who want to work with PERKAMA and be in our network. So it doesn't have to be counselors who are doing the job, and we always need other mental health professionals with us to be able to help the community. Inshallah, we're going to be in a good hand. Inshallah.
And last but not least, our dear Dr. Anne.
Thank you, Prof. I think my take-home message would be that if the thoughts ever come to you, take a moment, take a breath, think about the people who loves you, think about the people that will be affected by your decision, and think about the good memories that you had, all the good things that you're grateful for in this life. And I think about how they feel if you're not around anymore, and know for a fact that is that something that's best for them, because at the end of the day, we sometimes we need to think about the people that we left behind or we are leaving behind. What will be the effect on them, and in that moment, take a breath, take a moment, think about those things. Correct.
The podcast. I would like to end the discussion. It's a very lovely discussion for today. And when we are born into this world, we are crying, and the others are smiling. And one day, if Zahari die, I'm smiling. Most probably the others are crying. So before we come to the end peacefully, please embrace life. That is a very important thing that we would like to have the discussion for today. And again, I would like to thank Dr. Azra, who really worked very hard inside. Thank you so much. And the team, who really managed to have this thing reality. Thank you so much. It's a very lovely meeting all of you. And of course, to our dear Dr. Janaki from Spring Hill, thank you so much for joining us, even though it's online. Dr. Haniza, thank you so much. Mr. Kumaris, thank you so much for a lovely sharing moment with the student affair. And of course, our Dr. Anne, which is also my boss, and thank you so much for everyone. Thank you, everybody. Thank you, Wellbeing Research Center. Thank you. Till we meet again for the next coming UCSI podcast. Again, with that, I end the session. I end the session. Thank you very much. We meet again. Goodbye. Wait.